Good day, family, and welcome to another episode of Faith Talk. I'm glad that you were able to join us today. Listen, I want you to do me a favor. Share this to any person you know because we're going to be learning about very vital information from these great two women of God. So we have two special guests with us today, and they're going to introduce themselves, and we're going to ask them what they do and why they're here today. So can you all give me your name and what line of profession that you do and how long you've been doing it?
My name is Tanya Nelson. I'm a registered nurse. I've been a registered nurse for 20 plus years. We don't need the rest. I am currently employed at the Florida Cancer Specialist, where I've been an oncology nurse for 15 years. And that's it. And Jess?
And I'm Jessica Mathis. I have been an RN or a nurse. I started out as an LPN for a little bit over 10 years. Um, and I am currently a director of nursing in West Bradenton at Surrey Place. So we do nursing home rehab care, and I've been there about 4 years as the director of nursing.
So these two young women are here to inform us, educate us, tell us about themselves. They are registered nurses in the state of Florida. They have been doing it for over decades, and they have been members here at Bethlehem for quite a while. And they are Christians, and we are going to just ask them their thoughts, their feelings, how they've been working through their profession as Christians. And we're just going to learn more about Tanya and Jess today. All right, is that all right with y'all?
It's fun.
Okay, so let's get into this first question. So, just tell me, what made you want to go into the profession of nursing or the medical field at all?
So I was a pharmacy tech at first, and my mom had she was born with a heart deficiency or a heart issue, and seeing her hospitalizations and seeing her interactions with the nurses got me really into wanting to be a nurse, wanting to be better, and even being in the pharmacy. I did retail pharmacy for most of the time, but I also did hospital pharmacy. And so even seeing the nurses there and talking to them, I just really was intrigued and wanted to learn more about my mom's condition as well. And that made me want to be a nurse to help her.
So, were you a young girl when you figured that out, or a young adult?
Yes. So I got 20 in my early 20s.
Okay, cool. That's cool. So, Tanya, tell me, what made you want to get into the profession of nursing?
As a little girl, I have always wanted to be a nurse. I never questioned it and I never wavered. When people asked me, what do you want to be? It was always a nurse, and I never changed. And I went to nursing school immediately after high school.
It's cool. So, you all have been working in nursing between the two of you for years, and you've seen a whole lot of things in your profession. In the medical field, tell me, has there been an instance, a case, or a patient? You don't have to name names or name cases, obviously, but in your personal experience as nurses, has there been something that you have seen that you just couldn't believe that this is in the hospital, or this case is happening, or I'm watching this unfold in front of my eyes?
I can say personally, to what's going on into the world today. When I was in nursing school, one of the professors found out that I was a teenage mother, and being an African American female and a teenage mother, she was teaching us how to draw up drugs and do an IV push. And she came over to me and she kind of degraded me, saying, a teenage mother, huh? You still want to be a nurse? You think you can do this? And what we're dealing with today, dealing with racism, She picked me out of the whole clinical to come over and question me during this critical time where I'm drawing up a medication that I'm going to be giving to a patient to ask me questions about my personal life, being a teenage mother, what made me push, and why do I want to be a nurse.
So let me push that a little bit further, Tanya. You went into the thought of you experienced prejudice and racism even as a young girl in a space that you really wanted to pursue. Did that discourage you at all, or how did that make you feel in that moment?
It did discourage me at that moment. I'm grateful that I have a strong grandmother and a strong mother. Um, when I was pregnant as a teen, as a young girl, I told my grandmother I didn't want to go to church because I was embarrassed. She influenced me to continue to go to church, and I did, and not worry about what people said. And that day in my clinical, I remember when I went home to my mom and I cried. I said, "Mom, this is what she did to me." And my mom looked me in my face and she said, "You young teenage black girl, you will prevail and you're going to push."
Amen. Yes. This is so good. This is so good. Jess, please tell us, like, what is something that you have seen that we were like, wow, I cannot believe what I'm seeing.
I don't really know. I don't have as a diverse work history as Tanya does. Haven't worked in the hospital. I've only been in like subacute rehab and nursing homes. So my kind of wow moments would just be dealing with some of those family members. They can be a little difficult in some of the expectations and some of the things. And then maybe end of life, you know, the differences. You can definitely tell at end of life, some residents are so peaceful and are so ready, and some just fight at the end and are so scared to die. So I don't know if that's a religion, if they've made, if they've been saved, if they've given their self over, and they're ready for heaven, and or they haven't, they don't know about heaven, or maybe it's their life. Maybe they lived a harder life, a better life. I'm not sure, but yeah, I haven't been in the hospital, so that would be about it.
So let me push that.
Okay.
In your line of work, in the actual area, you said nursing homes and rehab.
Yes.
In you're working with people that are of older age, and those who are rehabbing from injuries and stuff like that.
Yes.
Am I correct? So tell me, has there been a patient or an experience with a patient that caused you to, not even just a patient, but your experience on the job? Has there been an instance where you rethought, or you just thought to yourself, why did I pick this profession?
Oh my goodness, yes.
Absolutely.
Like what was that like?
Um, so I would say, there's patients that can be very mean and nasty and fighting, and you think to yourself, why am I even doing this? Nobody, they don't want to help themselves. And I'm trying to educate them on the importance of their medications, or I'm trying to give them medications, or I'm trying to offer life saving measures, and they're fighting against me. Why am I doing this? Yeah, that's about it though.
So that has risen in your mind, like that thought, like, why in the world am I trying to force this person to do this?
Yes.
What about you, Tanya?
My moment was recently. I love being a nurse. I'm a caterer, I'm a comforter. But due to this COVID pandemic, I almost ran. When I was in the hospital setting, when the it started, and being at work and knowing that people are dying daily with the COVID, I'm like, Lord, I'm ready to run because I know I became a nurse to help, but I'm scared to take care of a COVID patient. And that's when I went back full time in the oncology setting where I'm still faced taking care of COVID patients. So I can honestly say that the COVID pandemic really made me question um, my nursing abilities. But I prayed about it, and I said, God, I'm a nurse for a reason, and I know you're going to protect me, and I'm going to take care of these people.
Wow, that is amazing from both of you. Both of you are on the front lines as healthcare workers. And first of all, let me thank you all for everything that you do. And Tanya kind of hit the nail where I wanted to go as far as fear working as a healthcare worker with COVID-19 going on. Cases, hundreds and hundreds of cases coming in every day. Um, Jess, you work with people who are elderly. Uh, have you come across any people or patients that have come with the disease?
No, I haven't. We have been very blessed in that area. As you know, there's been multiple nursing homes in the state of Florida, and even in our community in Sarasota and Manatee counties that have got COVID in their building, and it spreads like a wildfire because we care for the most vulnerable. So, with that being said, we are really under a microscope right now. We Everything is being watched, everything is being measured. We have a lot of regulations. I'm sorry, related to COVID. When we admit a resident from the hospital, they have to be tested already and they have to have a negative. If they have respiratory disease, they have to have two negatives to come into our facility. They then go onto our COVID unit, which is an isolation unit that only holds residents who are under investigation for COVID, and they stay there on isolation for 14 days. So it is very difficult because these are patients who were living at home independently, in some cases, go to the hospital, and now they're in a nursing home, confined to their room, cannot have family come visit, cannot have any outside gifts or food come in, and their nurses and CNAs are coming in total PPE. So it's scary and it's
What's
very difficult.
PPE?
Personal protective equipment, so masks and shields and gowns and shoe covers. You don't have that interaction that you used to have with your patient, so it is difficult. But no, we have not had COVID yet, fortunately.
Praise God for that.
Yes, praise God.
Praise God for that. Shifting to this, with this pandemic going around for both of you, has there been a heightened sense of protection for your family? You being nurses in your line of work, your healthcare workers, you know information that the common man or woman does not know due to this pandemic. Has there been a sense of fear or heightened sense of more protection for your family due to this pandemic because how severe it has become, especially in our state? Has there been that, like, you want to just overprotect or make sure you're going the extra mile of boundaries to keep for your own families?
Yes, it is. I worry every day when I walk into the house, like, do I have anything on me? So I go immediately straight to the shower, get out them clothes, and before I even interact with my family. I know some nurses go as far as they take off their clothes in the car and keep a towel and just go straight to shower. So it is. I'm more protected of my family now than I was. I don't go see my grandmother due to her age, and yeah, it's scary. So I make sure that I don't have much interaction with my family. I'm confined to my room a lot just to make sure that I don't spread the disease.
Yes, I can definitely reflect what Tanya is saying. Same thing when I get home, especially when I've had those interactions with those patients who are on isolation. I right away go straight to the shower. I have educated my kids on COVID. I make sure they know how to properly wash their hands, how they can take precautions against the disease. And yes, making sure I carry Lysol and hand sanitizer with me. I Lysol my shoes and everything. Take off the shoes before I get in the house.
Good, good, great, great. So let's shift here a little bit. Um, you all being very dedicated healthcare workers, has there been moments or instances in your careers that you've had to place your personal cares or your family or your life on hold, seeing that I have to push myself into my career going forward in order for me to help build my family? Have you ever found yourself in moments of your career that you've placed even your family on the back burner because you had to make sure this was taken care of, that was taken care of in your profession?
That's the that's with any healthcare worker. That's a daily thing that we do. I work in oncology where it's cancer patients, and these people are fearful. They're fighting for their lives. So no matter what I'm going through with my family, I have to put that aside to give them hope, to give them faith, and give them a good outlook on what they're going through. I never forget, my son never understood when he had a holiday in school and he was off why I always had to go to work. Mommy, why you have to go to work? I'm home. But he was young and he didn't understand that as a healthcare worker, there really are no days off. And I would say that all healthcare workers put their family on the back burner to take care of their patients.
Absolutely, I agree. Even I started out, like I said, as an LPN. So going to RN school, I already had started my family. Um, and I missed important milestones such as my son starting to walk, because I was going to school full time and working full time. And not to mention, these days, you come home so mentally exhausted and drained that you have no more to give to your children and your family. Sometimes I just need a quiet moment. Just let me be in my bedroom, leave me alone, because you give your all to your patients and to your work.
Wow, that's a good point, Jess. Great point that you all do so much for this world and you put your lives on the line every day. You even go the extra mile, go overtime, stay a couple hours late maybe, and some most times you may have to work weekends. I know Tanya, it's a lot of times you have to work weekends, and that takes away from the time to yourself. And to come home, you just want to unwind. I don't want to see nothing about the news, about sickness. I don't want to talk about the hospital. I don't want to talk about the nursing home. I don't want to talk about nursing. I don't want to talk about medical field, medicine, whatever. I just want to unwind because you give yourselves and your lives for hours at a time. Let me ask you this. What's the longest shift that you've had to take in your work? The longest shift that you ever had to do?
I was scheduled for a 12-hour shift. I had to be there at 5 a.m. and I didn't get off to 7 p.m. that night. the longest.
Lord Jesus.
Yes, for me, I was brand new at the facility I was working at. It was my first shift on my own, and it was an 8-hour shift. And the nurse behind me called off, so I stayed another 8 hours. So 16 hours, and then the other nurse called off. But I didn't stay past 16 hours. The supervisor,
Lord.
yes,
My God. Wow. So that was a hazing.
yes,
Basic.
yes,
They hazed you.
yeah.
So let me ask this to you all. You all being in the medical field and being Christians, some people may think because you're a believer and you have faith, that that's all you need, even when it comes to medicine. Uh, do you share the thought that God can work through medicine as well as the balance with your faith that can lead to your healing?
You have to be very careful nowadays with religion and health, because you never know a person's background. Where I work in oncology, I have had patients come to me and say, well, the doctor told me I had 6 months to live. And my response is, he don't have the last say so. Um, if a patient come out and flat out ask, what is your faith, I'm able to share it. And I have been asked to pray with a patient, but they have to suggest. You can't do it for them because that would be, an issue. Um, I had this man just on Wednesday, which shocked me. He said, I have a prayer book. My mom passed away, and the prayer book is 20 years old, and I want to know if you would like it. I'm not a religious person, neither is my sister, but it's something I see in you when you walk around here, and I don't want to just throw the prayer book away. And I agreed to take it. So if I'm asked to pray or share my religions, I do, but just to offer as a healthcare worker, you can't do that.
Mm. What about you, Jess?
Same exact thing. If I have prayed with my patients as well in my residence, if they ask for me to pray with them, or if they ask for prayer, a lot of times it is at the end of life. Recently, during the COVID, a lot of residents have increased depression because they're not able, they're in the last years and now they're not able to enjoy their family or enjoy going out to eat. So right now is a really huge test for everybody. So yes, I think now more than ever, I've been praying with my residents and even some family members. But like Tanya said, it's if they bring it up first or if they ask for it first.
Let me ask this, starting with you, Jess. Has there been a an obstacle because of your faith and you work in the medical field? Has there been an opposing force, like an opposition that because they know you're a Christian, has there been an obstacle in your line of work?
I I can't say no. I don't think so. Not for me.
Mm-hmm.
Not in my line of work per se, but I can say in my family and my friends. When family members or friends go through a sickness or a trying time, I have to wear two hats. I will look at an individual, and my nursing side will say, I don't know if they're going to pull out of this, or if they do, they're going to have this, 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 this. And then my spiritual side say, but God. So it's tough. It's more tough to me. I don't know about you, just knowing the medical side and just having my faith side, because then you have to balance the two.
Absolutely. I agree.
Go ahead.
No, I agree absolutely with what she's saying because, we have that education and we work in that field. So there are times when we're like, ooh, that doesn't sound too good. But your friends and your family are looking at you for, for that prayer and for that encouragement and that faith. So you have to kind of take that nursing hat off and remember that he does have the last say so. And, remember that, it's not always factual and about, what we know.
Amen. We are dealing with two different pandemics. And we spoke about this before we aired. And I wanted to go here. I've gone here with every guest that we've had so far. And I wanted to get your thoughts. You all have children. And dealing with this pandemic of COVID-19 is one thing, but we are also dealing with the pandemic of racism and bigotry. And for you having children in this country, and it's very interesting we're having this conversation because Jess, you are married to a black man, and your children share your race and share your husband's race. So I want to start with you. What are your feelings of what you've had to share with your children about what's going on in our country?
So my husband and I have had multiple sit downs with our children, and we have tried to be very transparent and let them know exactly what's going on and the injustice that's happening right now and the racism that's happening right now. Those of you that know my children, my daughter is, she's kind of, she doesn't like to talk about it. It makes her very uncomfortable. So I kind of have to push her because I feel it's very important for these kids to hear this and to know about this and to know what to do when it's brought up amongst their peers. My son, on the other hand, he is very interested in it, and he wants to go out to protest and everything, which I encourage that. That's wonderful. So yes, we are very transparent. We have those conversations. They're not easy conversations, but they're needed. They're necessary.
What are the ages of your children?
My daughter is 12, and my son just turned 8.
Tanya?
Well, my son is 18 and a little older than just kids. And being an African American male, I have been talking to him since he was little, and it hurts that we still have to have these conversations in today's time. That I have to tell him, remember, you are an African American male. You're going to be profiled. You're going to be stopped. And he was faced with the opposition where he was stopped by the cops and was treated poorly and just because of the color of his skin. So all I can do is reiterate to him over and over, come home alive. And that's what I tell him each time he leaves. Be safe and come home alive.
Wow, I can't even imagine the thought of having to think of the fact that once you send your child out into the world, just outside the house, probably just going to pick up something to eat or hanging out with a couple of friends, you don't know if that will be the last time you see your child. And that's heartbreaking.
Absolutely.
That's heartbreaking. And to have those conversations with your children from very young ages and even have to reiterate those conversations as they become young adults, it helps shape the type of world we live in and the type of dynamic we have as people in this country. So it's very heartbreaking. It's very uncomfortable. It's very it can make you upset. It can make you mad. It could just make you not understand or comprehend
Absolutely.
what's really going on. And I talked with you all just briefly before we started shooting about, of course, you having your children having to have those conversations, and I mentioned the fact that we are in a day and time where this generation, all they see are images and videos and photos of police brutality. So they have no recollection of police or law enforcement that are there to serve and protect. All they see are videos of young men and women of color being roughed up or being shot, murdered, and all of that, and being unjustly incarcerated. So that's all they know. Tell me, Jess, you spoke to it about your daughter, how having those conversations can be very uncomfortable for her because she just doesn't want to hear it, and that can be the dynamic for a lot of children. They know what's going on, but it's so negative and it's so bothersome that they don't even want to talk about it. Just in your opinion, what, I don't even know how to ask. Like, how do you feel we can deal with this in this time when it plays so much on our children's mental health?
So with my daughter who's in middle school, if I feel I'm not getting through to her, going to other family members or our pastor and asking them to have a sit down with her. I've asked other family members advice on just maybe how I can kind of get her to come out of that a little bit. So yeah, going to other family members and having those discussions, and having those if she starts getting uncomfortable, we take a break. We kind of stop at that point, but we revisit that conversation. We don't let her being uncomfortable stop us from having those important conversations.
Great, wonderful. How about you, Tanya?
I agree with Jess. All we can do at this time is talk, pray, talk. And if they don't get it from us, they can get it from some other people, like other family members, other pastors. And how many times I done came to you and said, "You better talk to Eddie." So you just can't stop. Even through the uncomfortable moments, you got to continue to pray and talk.
Wonderful. You as nurses, share with us, share with the audience and all of us the importance of our social distancing, our self care, staying at home. Tell us the importance medically or however you want to uh, discuss it. Just tell us why we need to stay home.
So a lot of people are testing right now. I know I have to be tested every 2 weeks. Before we started recording, Tanya shared a story with us. So I'll let her touch on that part. But just knowing that if you're negative, that doesn't mean an hour after you've been tested, you can't become positive. So don't let that guard down. A lot of us are healthy. We can get COVID without showing any symptoms. However, we can carry it on to more susceptible individuals, such as the elders in our families or even in grocery stores. So just because you're feeling great does not mean you are not a risk. Wearing a mask is so very important to protect others when you're unable to socially distance. And then socially distancing, of course, is so very important to protect everyone.
I have to agree with everything that Jess said. The story she was talking about, I know an individual that was tested and was negative. 3 days later, she got a fever and just thought she had a cold, stayed home for 4 days, and ended up dying from COVID just because she was tested negative. She thought she was out of the woods. Um, Hand washing is so important. These are things we should have been doing, but it's more important now to stay at home as much as possible, to wear your mask if you're out anywhere. A lot of people are saying that it's taking their amendments, but you could be taking a life. So, with Jess, as I say, please wear your mask when out. Only go out if you need to, and please just wear your mask and be safe.
And this is information from two certified state registered nurses. These are two women who are well versed in their professions and have been doing it for years. I appreciate both of you and your time, Jess and Tanya.
Thank you.
Thank y'all so much. Listen, share this episode. Don't let this go unnoticed. They have given us vital, important information for us to stay safe. Use your noggin and be social distancing. Keep your mask on. Everything that they discussed today, take it to heart and use it in application. Thank you for joining us today. We hope you join us next week when we come with another special guest. We pray that God is with you. God bless you, family.